SmashUSMLE Reviews. If this is the first time you're watching,
you've been studying how.
If this is the first time you're watching our session, I just wanted to welcome you guys to our live online just advice session. Okay, so hey, my name is Dr. Addition. If you're just coming in right now, I just wanted to let you guys know that my name is Dr. Addition. I'm a board certified emergency medicine physician, and I've been teaching USMLE board review for the last 10 years, And if you guys are not familiar with me, if you probably seen me on YouTube before or seen a video, hi everyone. Just kind of, put the comments in the comment box right there and let me know that you've seen some of our videos. If it's a USMLE video, you've probably seen some of my, advice video or just in general. So, here today, I'm actually here to answer questions for anyone who is either studying for the USMLE or studying for the complex exam, and you wanted to just know, Dr. Addition, hey, like what am I supposed to do? Or I'm an IMG, I am from another country, and hey, what's up, Turnsir? This is Dr. Addition. Tell me about yourself. Where are you from? Where are you from? So here I'm here to kind of share with you guys some of my stories of how I got to become an emergency medicine physician. So I'm originally from Nigeria. So I came from Nigeria, and that's basically where I grew up. And when I got here, I came to America in search for the American dream. And my ultimate goal was basically, hey, I want to become a doctor, and people doubted me. I remember trying to get into medical school when I was in college, and my advisor told me, hey, listen, man, I don't think you have a chance. And I said, you know what, I'm gonna prove you wrong. I took my MCAT. I didn't really do well the first time, and I remember just struggling to get in. I did very well in college, and eventually somebody gave me a chance to get into medical school. And when I got into medical school, I went to University of Medicine and Dentistry, School of Osteopathic Medicine. And that's where I trained. I took my USMLE Step 1, took USMLE Step 2 CK. I also took, I did take Complex Level 1, Level 2, and Complex Level 3. So my journey kind of came full circle because I had to prove a lot of doubters wrong, because it was a lot of work, trying to get into medical school. And if you guys are here in the United States and, trying to get into medical school, you know how difficult it is. What ended up happening was, I did really well in Step 1, Step 2, Step 3, and I ended up trying to get into emergency medicine. And it was difficult. It was a lot of work, but I was able to publish a book when I was in medical school and I had to study for the USMLE exam. And I ended up starting a company called SmashUSMLE.com. Now, if you guys don't know about SmashUSMLE.com, some of you may be familiar with Kaplan or DIT or USMLE RX. And, you guys might, say, hey, listen, I'm trying to study for the USMLE, and, it's become the worldwide gold standard pretty much for anyone who is trying to get into medical school, get into residency. And residency has become very, very, very competitive. It is insane what you have to do to get into residency today. Back when I took the USMLE, I thought it was competitive, and the astronomical numbers of students who literally are trying to get into residency today, it's crazy. It's crazy. So if you guys have joined us for the first time, my name is Dr. Addition. I'm a board certified emergency medicine physician. I've been an attending for 5 years, and I've been teaching USMLE test prep for the last 10 years. I'm here today because I wanted to answer your question. If you have any question and you're studying for the board exam and you wanted to, hey, listen, I'm just trying to study for the USMLE, or how do I get into medical school, or how do I get into residency, or what are your tips and tricks on how to study for the USMLE? I'm going to be sharing a couple of things with you. I'll pull up my PowerPoint slide so I can show you guys, some of the things you all need to do to be able to get in. So I'm literally here available for you guys. Just feel free to send me a message. So we have Florentin Tansa here. Are you a medical student, or are you in medical school, or applying for residency, or tell me about yourself? Okay, I'd like to kind of get to know you guys. Okay. So my ultimate goal here is, this is a free live session, okay, that it's going on YouTube today, and we're going to be having it on Facebook also. And basically just to, let me know if you have any questions regarding the boards. Now, so the United States Medical Licensing Exam, which is the USMLE, is, it's basically an exam you have to take to get into residency. So there's a step 1, step 2 CK, there's a step 2 CS, and a step 3 exam that you have to take to even to get into residency. Now, if you're a United States med student, you only need step 1, to get into residency. That's all pretty much you're gonna need. You don't need more than that. Some students will take, step 2 CK just because they're trying to either increase their step 1 score or something like that. But majority of the students, once you take step 1, that's enough score to be to get in. Now, the average on the exam right now, if you're a US med student, even an IMG, the average for step 1 right now, it's about 228, okay? That's a very high score, okay? It's about 228, and back maybe 5 years ago, it was like 221-ish, and the number keeps going up every single year. Every single year, students are doing better and better and better on this test. So it's getting more and more difficult for program directors across the country to be able to, just select you just based on just your list of recommendations over overwhelming applications. So they are literally screening students out who are trying to get into residency by their board scores. It's crazy. It is ridiculous. Literally kids in medical school right now, the moment they walk into medical school, they're just trying to get as high as possible on the USMLE as they can. That's what the students are doing. Now, I don't blame them because, listen, the cost of medical education is outrageous. Okay, I'm gonna be the first to admit that when I was in medical school, I said, oh my goodness, medical school is really, really expensive, right? And I was paying $26,000 a year, and I thought that was a lot of money, okay? And then today, the average cost is $50,000. 50 grand, guys. It's a lot of money. It's $50,000 just to get your tuition. So, I had a student last week who was shadowing me in the emergency department and told me she's taking out $85,000. And that $85,000 she's taking out, that's after she got a $10,000 scholarship. She's taking out $85,000. Okay? So that's the reality of today, guys. That's just the reality of what we are looking at, that students, the amount of student loan burden on medical students, it's outrageous. Now, if you do the math, right, at $80,000 a year, 4-year education, right, that's about $340,000 a student's gonna graduate with. So obviously, the competition is gonna be fierce, right? Because if you graduate $340,000 out of medical school, right, and you don't get a job, that's not funny, guys. Okay, $340,000 is the cost of a house, a nice house, by the way, too, very, very nice house. And the problem is that you need to be very, very strategic. Now, we're not even talking about students who are going to the Caribbean islands. Don't even get me started on that, because if you end up going to the Caribbean islands, you're probably going to walk out with $400, because you got to cover the cost of flying over to the Caribbean islands, the cost of going back and forth, living expenses on campus, and most of these are private institutions. So it's even more challenging that trying to get into some of these medical schools might be a little bit easier, but the problem is it's tough. It's really, 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 really tough just to come back out with all the student loans. And do you know the match rate of students who are going to Caribbean island right now? It's about 50%. 50%. So I tell students who are trying to go to the Caribbean island, and I said, listen, if you're trying to go to Ross University, Antigua, AAU, or all these Caribbean medical schools, you have to understand what you're signing up for, Because the problem is that these schools have a lower bar to take you in. They literally, they don't mind you coming to their medical school, but their job, okay, let's say they take 1,000 students at the Caribbean Medical School, okay? And, you know, and if you're joining us right now, I just kind of want to take a little break. This is a USMLE session talking about getting to medical school, getting through the medical school curriculum, talking about how to survive medical school, how to get into residency, getting through the USMLE exam. This is what this session is all about, okay? And I'm gonna be real with y'all, okay? This is gonna be a real session. If you have a question, just put it right in the comment section, and I'll be more than happy to answer your question, okay? My name is Dr. Adeleke Adesina. I'm a board-certified emergency medicine physician. I've been, you know, practicing medicine for the last 7 or 8 years, including my residency, and I'm here to be able to give you a free session. And you have any questions, just put it in the chat box right there on YouTube, and then I'll be more than happy to basically answer your question. So back what we're talking about. We're talking about this Caribbean Medical School. So, you know, these students are literally, you've tried to get into medical school here in the United States for a very long time. You applied 3, 4, 5 times, right? And you failed, and you come up to me and say, hey, Dr. Adesina, listen, should I go to the Caribbean island? I say, listen, let me tell you what's gonna happen to you. It's gonna be easy to get in because they will take about 1,000 students per class or 700. And their ultimate goal in the first year is to make sure they fail out 50% of the class, literally. Their goal is to fail out 50% of your classmates, which means you've taken out about $100,000 to get into this. They lure you in, right? And if you're a weak student before you go to the Caribbean island, remember, it's going to be a lot of self-education. Medical schools today, it's all about self-education, right? You go to class and most students don't want to go to class anymore because all they just want to get through is get through the notes, memorize, spit it back out, and try to get through the USMLE or the complex exam. So right now, the problem is that they'll take about 1,000 of you. The professors are mandated to fail 50% on purpose, because the goal is, if I fail 50% of the classroom and the other 50% applies into the match, if 50% of those 50% match, it looks like we have a 50% match rate, right? It looks like you have a higher match rate, because if out of 700 people that you took, 350 got cut off in the first 2 years, and then maybe 200 of those people match out of 350, then they can publish and say, hey, we got a 50 or 60% match rate. But that's not true, guys. Don't fall for that stuff, okay? Don't fall. Let me show you guys some data, okay? Let me show you guys some actual data. So I can open you guys' eyes right here. I have Christina right here on the line. You know, she's asking what is the match rate for IMGs. That's an awesome question. Listen, Christina, last year, the NRMP just published this data, just came out, and the match rate was 52%. Now, let me clarify what that 52% means, okay? Because sometimes, you know, that is actually a great number. That is an awesome number for an IMG rate to be able to match 50%. Now, the average IMG right now is applying to 150 programs. You have to apply to more programs. I remember when I was applying to residency, right? I applied to 50 programs. I got 17 interviews matching to my top 3 at St. Luke's Hospital. That's where I trained in emergency medicine. But what ended up happening today is the average US medical students are applying to like 80 programs, right? To even increase. So now the application pool is getting even higher and higher. It's crazy, guys. It's crazy. But even at its worst, the students are actually who are matching for IMG programs from IMG, who are international medical graduates, are actually getting in at 50% match rate. That is a great number, guys. Okay, that is a great number. All right. So here's the catch. Most IMGs are going to apply for family medicine. They're going to apply for maybe pathology. Some are like maybe neurology, internal medicine. Like these are like the top numbers IMGs are applying for. So if you go to a Caribbean medical school, your chances of matching into dermatology, you know, orthopedic surgery, emergency, is very low. It's about like 2 or 4%. Okay, it's really, really, really low. Okay, guys. So, you know, you need to understand this. It's really, really, really important that you know your numbers before you apply to these programs. So if you want to do orthopedic surgery, okay, if you want to do orthopedic surgery and you end up in the Caribbean islands, your chances are so low, it's so bad. I'm just being honest with you guys. It's not like it's impossible. It's not impossible, but you got to know what you're coming up against. Like you can score 250, 260 as an IMG, and you may not even get into orthopedic surgery. Because you know why? Orthopedic surgery in the United States right now, most of these programs will take only about maybe 2%, okay? They will only take about two to four students. Give me a second, right, guys, okay? Just give me one quick second. We've got a couple of questions here, okay? Let me take some time out to answer some of your questions. So we have my exam, my step 1 exam. So Damian Roland, my step 1 exam is in 3 weeks. What's the most important thing I should be doing, by the way? I'm originally from Houston. Awesome, awesome. So Damian, so tell me about, what you've been doing. I want to know, like, if you're taking your exam in 3 weeks, you completed a Cuban, and, have you done like, because it depends on where you are, right? 3 weeks right now before you take your USMLE step 1, I would recommend you take at least 1 NVME, okay? The NVME just literally released, it just released some new NVMEs, and I recommend this NVMe 18, this NVMe 20, 21, and 22, okay? So if you're taking your USMLE in 3 weeks, you're telling me right now, you're 3 weeks away, you should know a lot of information. Hey, shout out to you, by the way, I'm from Houston also, okay? So the key thing is that I would strongly recommend that you take an NVMe next week, okay? That's 2 weeks before your test. And look at your NVMe score report, okay? That NVMe score report will tell you if you're ready to take the test, okay? It's gonna tell you if you're ready to take the test or not. So that's kind of basically what I need you to do first, okay? So once you're basically, let me ask you, what's your target USMLE score? Okay, Damian, tell me exactly what your target USMLE score is. Because if your target USMLE score is a 240 or 250, and you take your NVME, let's say next week, and you're basically able to get about a 235, 238, 244, 245, then you're ready to take the test. Okay, because in 3 weeks, you're pretty much almost there. You're gonna have basically finished maybe a Cuban once or twice. That's what I'm assuming, right? And if you finish your Cuban once or twice, then you should be ready. You should be ready in 2 weeks. Now here's my caveat for you, Damian Roland. If you take your NVMe a week before, all right? So if you take one this week and you take another one about 3 days or 4 days before your exam, and you're not hitting your target score, cancel your test date. Yeah, I said that. Cancel your test date. You're not ready to take the USMLE. Do not walk into the USMLE exam hall, okay, with a low score, your NVMe score report. Because let's talk about the NVMe score report for a second. The NVMe score report is the best assessment. I mean, the best assessment that's going to help you determine whether you're ready to take this exam. Okay, I repeat that. A lot of students that I've met, and I've trained thousands and thousands of USMLE students over the years, and what I found was that they would take an NVMe, right? And the NVMe report would say, oh, you scored a 197 or let's say 200. And then you go take the exam, and then you score a 198. And then you're expecting maybe by some miracle, oh my God, I'm gonna get like a 244. No, you're not gonna get a 244 in the actual exam. You're wasting your time. Because the NVMe assessment that is the best test is accurate. Listen, this test has been around before, for about 20 years, okay? It's been around forever. So why do you think they've used it to test thousands and thousands and thousands of medical students for the last 10 to 20 years? And it determines how much knowledge you have. It literally screens out, do you have enough knowledge enough to be able to pass this test, or you don't have enough? That's all it is. So be honest with yourself. When you take this NVMe assessment, that's what's going to determine whether you're going to do well on the board, period. Or else you're wasting your time. Stop taking, thinking like on the exam day that you're going to score maybe a 220. When your NVMe report is saying you score a 201. Okay, guys? So this is really, really, really important. All right. So Damian, before you take your boards, all right, make sure that you're hitting your target number. Okay, so Damien said, I'm on my second pass through UWorld at the moment, and I still have some subjects to cover, of course. My target is 235 and up, and I want to get anesthesia/derm. I'm definitely open-minded. Okay, good. Now, let me give you a second advice. When you're doing UWorld the first time, right, you will notice that you're scoring really low on your UWorld question bank. That's true, right? You're gonna feel miserable, you're gonna feel depressed, you feel like you don't know anything. The second time you're going through the Q bank, let me tell you what's gonna happen. You already know the answers to the questions. The amount of knowledge you're gonna gain the second time is not gonna be the exact same one. You know, so never look at your score the second time you do UWorld Q bank. That, oh man, look, I used to get 20%, I'm scoring 80%. Because you already know the answers. Before you even read the question stem, you already know exactly what the answer is. You just pick the answer and move on. So if you're doing the UWorld the second time, what I advise you is take your time to actually read both the correct and incorrect stem, but know that it's not a great assessment at that point in time. It's just, and remember, Q banks are just learning tools. They are just literally learning tools. They're not, you know, like students are all caught up on how am I doing on my Q bank? Who gives a crap about what you're doing on your Q bank? Like seriously, why are you so caught up on the number itself? Okay, I'll tell you when the number is relevant. Let's say you finish your first and second year of medical school and you started doing UWorld Q bank today and you're scoring 55% average the first time around, hats up to you. You're gonna crush the USMLE in your first try, period. Not negotiable. I can guarantee you if you're scoring more than 50, 60% the first time you do UWorld, you're gonna get a 240, okay? But most students are gonna score between 30, 20, 25, 40%, 45%. And it's, yeah, that's normal. That's totally normal. Because you don't know how the boards want you to learn the stuff yet, okay? So listen, go through UWorld the second time, all right? Take that NVME, okay? I know UWorld has their own assessment test, but it's not the same as the NVME, okay? And I know you guys go on studentdoctor.net all the time and read all this crap on studentdoctor.net like, oh, I took NVME, and when I took my USMLE, it wasn't reflective. If you read the lines, your NVME score reports tells you that your score on this NVME report is plus or minus 12 or 15 points, which means, let's say you score 220 on your score report on your NVME, you're probably gonna score between 235 and 205. So it's got a range of what it kind of puts you into, but I think you should be fine, especially if you're going to the Q bank twice and you're getting the actual score you're hitting before the test. So let's hit the second question here. I got Dave Smith here. I'm a final year international medical student who's very much desirous of writing this step one. How can SmashUSMLE guide me to a successful path? Because I want to do general surgery residency. Okay, Dave Smith, listen. 80% of the students who come to SmashUSMLE Reviews are IMGs, okay? And here's what I want you to find out. In our course, because you're coming from a different country, we spend a lot of time retraining and reprogramming your brain on how to study for the USMLE, okay? So Dave, I'm gonna call you Dave. I would recommend you go to this link right here. Okay, I'm gonna put the link up for you guys. All right, and let me put it up for you guys here. And I want you to sign up for our free trial. Okay, we have a free trial on SmashUSMLE.com. Okay, and it's really easy. It's free. Okay, and once you just put your name on your email address there. Okay, and then just sign up for a 15-day free trial. Now, let me tell you what SmashUSMLE Review really does. And I've spent the last 10 years, teaching USMLE in and out. Our students have scored between 240, 250s, an average of 220 to 238 in our program here. There's a couple of things you're gonna find out as an IMG. You're gonna come to America or come from your country or stay in your country and try to USMLE, and you're gonna be confused. You don't understand how the system works. So you're very confused, and you're gonna try to go reach out to people who are doctors here in America. But guess what? They're too busy. They took the USMLE about 10 years ago. They're not helpful. They're not gonna be. And then here's a common theme you're gonna find out. Oh my gosh, you wanna study for the USMLE? Do UWorld, read first aid, right? And take the test. Maybe it's pathoma. Oh, that's another favorite. UFAP, right? You go on studentdoctor.net, and the first thing they say, oh, all you need is UWorld, first aid, and pathoma, and then you get a 240 in the exam, right? So here's my first aid right here, right? So this is the 2018 edition of first aid. Now, the problem is that with that advice it's not a bad advice. It just doesn't work for you. Because as an IMG, when you come to this country, you learn a different way. Now, if you're a medical student in first or second year of medical school who's going to take your USMLE, man, like 6 weeks, yeah, that advice works because the knowledge is still fresh in your brain, right? But you coming from a different country, I guarantee you've forgotten half of the stuff they taught you in medical school. Not only that, the USMLE is a different beast. It's just a different beast. So if you don't understand how question writers write the question banks or write the questions for the USMLE, if you don't understand mechanisms of action of diseases, if you don't understand, pathophysiology, if you've forgotten all your anatomy and physiology and pathology and pathophysiology, if you jump into this, you just jump right out. So at SmashUSMLE, we do something, we call it a SMART program, okay? If you guys have not heard about the SMART program, the SMART program talks about, we call it the strategy, okay? And then M for mastery of clinical content, A for assessments of clinical knowledge, R for review, and test for test taking strategies. Now let me pull that for you. I want to share some of this with you guys today because if you've never seen this before, I wanted to show you guys our framework, and this is how SmashUSMLE really has helped thousands of IMGs over the last couple of years. Okay, let me share my screen with y'all. Okay, because this is how we design our program. We're gonna break it down the basics for you, and let me share this with all of you guys so you guys can see how our program really works. Okay, let me just change this, then it'll be perfect. All right, so we have something called the SmashUSMLE study framework. Okay, and if you're not familiar with this, we teach you the secrets to become a board insider. Okay, that's what we do. That's exactly what we do here at SmashUSMLE. Now, let me walk you through it real quick, okay? We're gonna teach you something called the NVME practice test strategy. We're gonna train you on how to create your schedule. And then we're gonna teach you about the intensive mastery period, okay? Now, what's the NVME test strategy, right? The NVME practice test strategy is literally, before you take your exam, before you even sit and start studying for the USMLE, right? I want you to go on this website, right? Okay, the nvme.org, okay, /student/SAS/SAS-HTML. This is the new NVME website, okay? This is the National Board of Medical Examiners. They're the one that sets the USMLE exam, all right? And they have all this free tests. So I recommend, listen, the first thing you sign up with your name and your email address, okay? And then you sign in. Once you log in, all right, you'll be able to purchase different NVME. Look, before it used to be NVME 13, 15, 16, 17, 18, and 19. But guess what? The good news is now they have 18. They've updated it for 2019. They have 18, 20, 21, and 22. So what I recommend is take the number 18. That's the lowest one, okay? Once you take your NVME, this is what you're gonna get. You're gonna get a score report. It's gonna look like this, okay? Let me annotate this so you guys can see. So you're gonna get this score report. And this score report is going to show you your lower performance, your borderline performance, and your higher performance. So I believe Damien is taking the USMLE in 3 weeks. And when she takes her NVME, I better be seeing a lot of red stars towards your higher performance section. So the way you interpret this graph is this. Right in the middle right here, okay, that's your borderline performance, okay? And what that simply means is that, let me zoom that out for you guys, is if all your bars stay within this range between the borderline performance right there, you're going to score between 190 and 210. You know why? Because when the USMLE was originally designed, it was designed so that doctors have to have the clinical competency to pass a board exam to be licensed to practice medicine in their state. That was the original intent of the USMLE. You guys may not know that, okay? So 30 years ago, when the USMLE was started, they said, listen, the National Board of Medical Examiners said, for you to be able to practice medicine safely and take care of patients in the hospital or in the community, you must meet the minimum requirement to be able to pass a licensing exam to practice medicine. Now, back then, all you need to do is score like, I mean, now today's like, maybe like a 180. I remember it used to be 188 was the passing score. all right? You know, let's say it was 170 back then, right? You get a 170, if you want to go into derm or orthopedic surgery, you get in there, it wasn't that difficult. Like, it wasn't like screening everybody for high scores. And over the last 30 years or 25 years, something happened, right? The demand to get into higher specialties started getting higher and higher and higher and higher, okay? Which means USMLE scores to match into such residencies started getting even much tougher. So now we have something called the E-roads to riches. So if you guys are not familiar with what E-roads mean, let's talk about that. E-roads start for specialties that are very high paying with very lucrative amount of money. That's basically what it boils down to. You're gonna get paid a lot of money if you end up in this specialty. You're gonna have a little better lifestyle, and you're gonna make more money than all your colleagues. So look, emergency medicine, radiology, ophthalmology, anesthesiology, derm, and surgery. Okay, all surgical specialties. That's what the E-roads to riches mean. Okay, it's called the E-roads, the roads to riches. Okay. Now, these specialties are very difficult to get into for a reason, right? Because if you match into them, you're gonna have a better lifestyle, life's gonna be better for you, you're gonna make a lot of money. Like a dermatologist is gonna be making easily $480,000 a year, or 500, you know, close to $500,000. That's a $500,000, guys. We're talking about real money. So I'm gonna be honest with you guys, because that's what we do at Smash Out. We don't mince words. We tell you the reason why things exist, okay? So what happens is that, you know, it takes tremendous amount of work to get into this specialty for a reason, right? Like, I'm an ER physician, right? Guess how many days I work in a month, guys? 15 days. Yeah, you heard what I said. I only work 15 days out of the month. That's because if I choose to. Right now, my full-time job is 12 days a month. Can you believe that? That's crazy. Like, as a full-time ER physician, I'm only mandated to work 12 days a month, okay? So that shows you the flexibility. I got 18 days out of the month. And listen, I'm home right now. Well, today's Friday. I'm off tomorrow. I work 2 weekends a month, and I only need to work 12 days a month. And they pay me good money. So now the road to get there is difficult, but the facts are the facts. If you do family practice, you're gonna work 9 to 5, stay after 5 o'clock to 7 o'clock in the evening doing charts, right? And to follow up, and they're not gonna pay you a lot of money. So this is why the USMLE has changed over the last 20 years, guys. It changed because the competition is higher. Now we have more IMGs, international medical graduates, who are applying to residency. There's about 20,000 international medical graduates applying to residency every year. So all of a sudden, these residency program directors are getting so much applications, they have to find a number to screen you guys out, okay? When I was a resident, right, we'll get 1,000 applications. We only have 12 spots, guys, 12 spots in my program, and that's even a bigger program. So we have to screen people out. So they'll use 220 as their cutoff, and everybody below 220, they won't look at your application. Okay? All right. Okay, let me take a little minute to answer a few questions. How can I get international doctors? Can you clarify what you mean by that? I'm a final year international medical student as well. Is it better for me to take step 2 before step 1? That's a great question, Nita. Listen, Nita, I hear this all the time from all the docs that come to America, or they want to take step 1 or step 2. Let me guess. The reason why you want to take step 2 before step 1 is because it's more clinical, right? It's more management because you've been a doctor in your country and you feel like, listen, if I take step 2 first, you know, and I do really well, it's going to be giving me a little more cachet, right? And then I'll go back and take step 1. Listen, I don't have any problem with that. I'll be honest with you guys. But honestly, why don't you face reality and hit the beast anyway? You're scared of genetics. You're scared of biochemistry. You're scared of biostatistics because you haven't read the glycolysis, gluconeogenesis, fatty acid, methylmalonic pathway, read about DNA synthesis in probably a couple of years, right? So you don't want to face the reality that those guys are coming, right? You have to learn every single book, gram-positive, gram-negative bacteria, right? Neisseria, Campylobacter, zoonotic organism, right? Histoplasmosis. I mean, and learn all the pharmacological drugs that they test on step 1. So you think it's probably easier. Let me go through step 2 first. And I don't have a problem with that. But this is what I tell all my IMG students. Step 1 is there for a reason because the knowledge stacks on each other. If you have a good solid foundation of step 1 anyway, step 2 is easier. There's a reason United States medical students don't take step 2 before step 1 because first they don't know management yet, okay? Just a fact, right? They haven't learned the management of diseases. But in the first 2 years of medical school, they're talking about pathology, they're talking about pathophysiology, they're talking about disease processes, right? They've taught them all this pharmacology, and they're like, dude, go take me some step 1 and come back, and I'll see you after you do your clinical rotations. That's a little mixed up now. Now they're mixing clinical rotations with their medical education, but so it's a little more integrated. And then they need to go take step 2. But it's the same information. So here's my advice for you. Take step 1 first. It's more difficult, but if you can get through step 1 and get me a 240 or 250 on step 1, dude, seriously, step 2 is gonna be a joke for you because you got through it. You got through step 1, and step 2 is just stacking up on step 1, guys. You have the luxury because you're an IMG. That's why you can come to America or take a step 2 before step 1. But actually doesn't favor you well, because if you don't do well on step 2, what do? What are you gonna do? You're gonna retake step 2 again, or go back and try to take step 1 now? Step 1 is the most difficult of all the steps for a reason. They test you on everything, right? Immunology, biochemistry, physiology, anatomy, pathology, genetics, mutations, you gotta know every cluster designation, monoclonal antibodies, and the list goes on and on and on and on and on. Okay? So do me a favor. I get excited when I'm talking, guys. I get excited because this is what I do for a living. Okay? Now, do step 1 first, and then go and take your step 2. Trust me, you will thank me later. Now, if you choose to take step 2 before step 1, I won't be mad at you. Just make sure you do really well on it. But you're gonna find out there's an overlap that it's basically half of step 2. Half of step 1 is step 2. So that's basically my take on that. So now, Dave, I got to be honest with you. If you're an IMG, it's not easy to get into a surgical residency. It's not impossible. It's just extremely, extremely difficult. SmashUSMLE will help you get the scores you need if you put in the work we tell you to do, right? We will teach you everything you need to know. We've got a QBank, right? Here's our website. I'll just put it up for you guys. If you guys are, by the way, if you guys are just joining us, I just wanted to, for some of you guys that might be joining us for the first time, my name is Dr. Addition. I'm the CEO of SmashUSMLE.com, and I've been teaching USMLE for the last 10 years. Just kind of give you a little background information. I'm a USMLE expert. I've taken USMLE step 1, step 2 CK, crushed both of them. Took USMLE complex 1, 2, 3. I've taken pretty much all the board exams. I'm a board certified ER physician, okay? Been practicing ER physician for the last 5 years as an attendant, okay? So here's our website actually, by the way. But if you come to SmashUSMLE.com, right? Let me show you guys some of the benefits when you come to it. We're not like Kaplan giving you all this garbage information it's not useful for the USMLE. And I'm just being honest, right? I hear a lot of students all the time. When I took Kaplan, I paid $7,000, and guess what? I didn't really know a whole lot of information. Well, guess what? Kaplan's job is to give you thousands and hundreds of books. They'll give you these 10 books when you come to their class and you freak out the first day. And then they never talk about first aid at all. And you're like, when are you guys gonna talk about first aid? When am I supposed to read first aid? They're like, read all these books first. And they're like, no, we don't do that here, okay? We don't do that here. We show you how to use your first aid. And so let me kind of walk you through our website real quick, right? And I'll come back and show you guys what we were talking about earlier, right? If you sign up for the course, for example, okay, and you come into the website, once you log in and you actually sign up, it's really easy. What we do is, you come in and you can see right here, this start here, right? First, I'm gonna introduce you. You can see myself here. You can watch the video. I introduce you to the program. And then you go to, study strategy, right? You click on study strategy, and this study strategy literally has videos, okay? 7 videos that you must watch, all right? We literally walk you through the overview of the SMART program. We'll show you the NVME practice test strategy, exactly how to use it. I'm showing some of that with you guys today. All right. How to use your first aid, right? Your first aid should look different from the beginning before you start in the end. Okay. The beginning, it should be nice and clean. By the end, that book should be ripped apart, okay, and flip into different, like a binder. And we show you the clinical framework. We teach you the unbiased way of how the question stems are written on the USMLE. And not only that, we will teach you the ease method of how to use your question banks. Like, this is not studentdoctor.net, guys. Stop going on studentdoctor.net and looking for advice. You're just wasting your time. People are there to brag about how, oh my God, I studied UWorld once for 2 weeks and I took my step 1, I got a 263, 244, and a 266. And you're like, dude, Are you a genius or something? Like, no. And then none of them will ever upload their transcript with their name and the USMLE ID to verify what they're saying. So you're taking advice from somebody who's behind a computer screen. You're just typing a bunch of words and you're panicking your house. For what? Right? These are, you know, yes, a lot of students are there for good intentions to look for advice, but you come out there with anxiety and depression. Right? Now, come on, raise your hand. Raise your hand if you've gone on studentdoctor.net or USMLE forums looking for advice, and then you walk out more depressed with more anxiety than you actually walk into. Why? Because a lot of these students are basically there to oppress other students. They want to show off their skill set. Yes, some of them give good advice, but how can you even verify who these people are? Okay? So here you have an opportunity to work one-on-one with me, a direct coach, on our website. If you sign up for our course, for example, you get a direct access with me. Like, we're gonna have a video session just like this that I'm talking to you right now. We're gonna, you and I literally are going to sit down one-on-one. We're gonna talk about a stride. I'm gonna coach you through the process, because I'm gonna put in front of your face what you're doing wrong, what you need to do different. We're gonna go sit down together to create your schedule, right? I'm gonna give you a sample schedule. I'm gonna tell you to do a certain specific test, because I'm here to coach you. That is what we do here at SmashUSMLE. We are not here to waste your time. Okay, guys? Stop going on these platforms that are just there because you don't know where else to go. And I don't blame you, because, you know, that's what everybody tells you, right? You pick up first aid. How many of you pick up first aid before, right? Look at my first aid, right? You pick up your first aid and you're trying to read the book, right? And you're like, let's see, hydralazine, cyclic GMP, smooth muscle relaxation, vasodilates arterioles greater than veins. Afterload reduction. What the hell does that even mean? What does that even freaking mean in your mind, right? Let me put this book back here. What does that even mean, right? But if you come to this course, we will show you why that is an important fact. I can tell you all about hydralazine in 2 minutes. Everything. Hydralazine is an arterial vasodilator, right? That's what it does. But why is that even important? Because it's going to decrease your afterload, but that's going to cause reflex tachycardia. Reflex tachycardia, because I just decreased your total peripheral vascular resistance. You learned that in physiology, right? Didn't they teach you that in physiology? But why is that even important? Because your patients that have hypertension have increased total peripheral resistance. So if I decrease afterload by vasodilating your arterial system, all of a sudden I lower your blood pressure. You understand what I'm saying? Now, that one is safe in pregnancy. However, if I have to give a patient that's pregnant another blood pressure medication, I've got to be careful, because I can't give them any kind of blood pressure medication. So if I ask you what is the side effects of hydralazine, just by what I just asked you, you would tell me, yes, it can vasodilate, but it can cause hypotension. It can also cause reflex tachycardia. Not only does it do that, right? Not only does it do that to patient, it allows me to control patient's blood pressure. So I use it when the patient has hypertension, right? So the USMLE, that's how they're going to test you on it. Okay, guys? Methyl doper will be an alternative to treat a patient that has hypertension in pregnancy, because I flip that same question. I say, hey, listen, which one will be a little safe? You can give hydralazine also in pregnancy. You can give labetalol in pregnancy. Okay, guys? But you cannot give ACE inhibitors in pregnancy. All right? Now, this is why we create the SMART program for you guys. If you guys are joining us for the first time, my name is Dr. Adeleke Adesina. I'm a board certified ER physician. I'm a CEO of SmashUSMLE.com. I am hosting this free session for you guys today just to answer your questions. I want to show you how to study for the boards the right way, okay? So this is how we have this SmartMD training course here, all right? This is not StudentDoctor.net, guy. This is the real deal. All you need is a specific strategic instructions to follow, and you're going to do well in the USMLE. There's a formula for success on the board exam, guys. There is a formula. Now, everybody might say, oh, you might say, Dr. Adesina, hey, listen. I know you're probably saying, you know, there's a formula for success, but, you know, isn't there like Cuban and videos and flashcards and Picmonic and Firecracker and Pathomer and USMLE RX and SmashUSMLE and Amboss and Lecturio? You know, which one is for me? Like, how do I know which one is for me? See, that's the question. Okay. Now, I would say you are absolutely right. Right? You go to the marketplace and try to shop for USMLE product, and there's first aid, right? There's USMLE RX books. Like, I mean, There's just so much information out there. Some of you guys even have free downloads. I know you guys listen to me right now, have free copies of either UWorld inside your computer right now. Some of you guys have a pirated copy of UWorld on your computer that somebody passed on to you that, hey, dude, here's some free UWorld Cuban, start using it, right? Right? But here's the catch. This is the problem. You go to Egypt, you go to all these countries, everybody's got a downloaded free copy of UWorld, and they're trying to do the questions, on the screen without a timer. I'm like, what are you doing? What are you doing? Seriously. You want to become a doctor in America? Let me tell you something. If you want to become a doctor in this country, you're going to spend money. It's not a cheap process, guys. Okay. The average medical student's graduating with about 350, I'll be at 200, 220 to almost $300,000 on average. That's the amount of money medical students are graduating. So if you come as an IMG and you think this is a cheap process, come on, guys. Let's be honest here. Let's just be honest. Like, you really think a student that spent $300,000 to go to medical school will not be given preference before you as an IMG? And I'm not even talking about IMGs that went to like Poland and you spent $6,000 for education and you try to come into the system. And you think they're going to also allow you to come in with the exact same amount of scores? You think medical students are trained doctors so they don't get a job? No, come on, guys. Let's be honest. So when I tell you guys as an IMG, right, and you're coming into the American healthcare system, do me a favor, get a 250, get a 240. That's your passing score, okay? And stop wasting your time looking at the score report on the NVME website. You know what? Let me find this. Let me find this score report. Let's take one quick second. Let me show you last year's matching rate of students that are matching to residency, that IMGs. Okay, somebody say, Mariam, don't worry, you're not late. Okay, this is gonna be the best advice session you've ever experienced, ever, okay? So Nita, I'm going to be taking my finals in January. On average, how long should I be preparing for step one? Question for you. Are you an IMG? Before you ask me questions, let me know if you're an international medical student or you're a US medical student. That's very important for me to know, because then I can tailor your advice the right way, okay? If you're a US medical student, okay, most US medical students study for about 7 to 8 weeks, 6 to 8 weeks, okay? We call that the dedicated study period. And I'm gonna show you guys that in a minute. If you are an IMG coming into the system, IMG, okay, good. Now, if you're an IMG, the advice I give you guys is this. You can literally study for 3 months straight, depending on how strong of an applicant you are, okay? Okay, you go to SmashUSMLE.com. Let me put the link for you guys here, okay? I'm gonna put up, so if you wanna get started with our free, it's a free trial for 15 days. Oh no, sorry guys. I think I put the wrong link. Sorry. Let's try this. Free trial. So if you're an IMG, then the second question I ask for you guys is, do you have kids? Do you have a response? Are you working, right? Because it's really, really important that if you're all in, let's say you don't have any children, you don't have family responsibilities, you're all in to study for the USMLE. You're like, Dr. Adesina, I'm ready to kick ass on this board. I'm like, okay, let's go. Listen. Then 3 months is good. 4 months, yes, maybe, all right? And what I'll recommend for you is that 3 months, your first 1.5 months, let's say you sign up for SmashUSMLE Reviews, for example, right? You decide to sign up for SmashUSMLE Review program. And by the way, we have a lifetime membership on our course. Like, if you sign up for our lifetime membership, you literally will have this course for 10 years. So you don't have to worry about, oh my goodness, oh man, I did not, I ran out of time, and you have access, okay? We give you 100% satisfaction guarantee, okay? Not only that, here at SmashUSMLE, we have something called the Smart VIP MD group on WhatsApp. So you guys, every day, like this morning, right? Here's my phone right now, okay? Let me show you what our students get when they sign up for our course. Not only that, this is our SmartMD. Let me try to see if I can zoom that in right there. See that? That is our private chat. It's only access, to all the students that are in my program, okay? In our program, if you join that course, you're going to get daily feedback from me. You get direct access to me on the phone, on WhatsApp. You can call me directly on it. You can send me a private message. That's what you get with SmashUSMLE. This is why this is different from Kaplan and all these programs out there, okay? I respond within 24 hours. You can talk to our team anytime. But listen, you get on our program here on WhatsApp, and, you know, and let me kind of scroll down a little bit. I send you different motivation, and every day I will send you a video, literally a video recording of me telling you the best advice on how to study for the board exam. I mean, that's literally what you get. You get a one-on-one, okay? Literally access direct to me as a physician, and I'm gonna guide you through the process. And we have hundreds and hundreds of students on our platform right now that I talk to every day, because we are not here just to play around. We are here to get you motivated and kick ass on this exam, all right? So here's the deal. Here's the deal, guys. Here's the deal, guys. If you spend 3 months studying, 3 months as an IMG, your first 1.5 months, we call it it's a time for you to get all the knowledge back into your brain. So on SmashUSMLE.com, for example, right, if you sign up for the course, right, let's say we go to step 1 video, right, we've covered everything in first aid. Now, you might say, Jackson, are you serious? Yes. We have a video literally on every section in first aid. That is how crazy our program is, okay? Now, we broke it down for you right here. Look, let's say you want to study biochemistry, right? And you guys can see my screen, right? And hey, look, we broke on cellular, lab techniques, vitamins, genetics, and let's pick, oh, okay, I want to study amino acid pathways. I don't understand the urea cycle. Boom, click on that. Okay, you can see each video has the timer on it. Okay, and this is a video. That's me teaching you on the computer. We also have an app, right? Let's play that video for a second. All right. So
next lecture we shall be talking about is the urea cycle.
Okay.
That citrulline that's formed in the mitochondrial matrix is not.
Can you guys see that? Can you see that? Now, if you were to read the urea cycle by yourself, right, in first aid, you're probably going to be more confused, because you're like, which is important? What's important, right? Right? But what I do for you is break it down and tell you all the high yield stuff you need to know in the pathways. That's it, okay? Some of these pathways are just long for no reason, but you don't know what's high yield or low yield. Not only do you get this, right? So you watch this video and you're like, oh, Dr. Addition, okay, I want to watch it in like 2 times the speed of the video. You click here and you go to speed and you pick 2 times the speed of the video. Check this out. Perfect. Look, now you can watch a 60-minute video maybe in like 8 minutes or 10 minutes, all right? Which means in 10 minutes, you've mastered everything in the urea cycle. And let's say you want to watch any other topic. You just click this drop down and look at that. This is all biochemistry right here, guys. Biochemistry. Watching videos, you know, electron transport chain, okay, TCA cycle, right? We go through everything for you, and the website is freaking phenomenal. Like literally. And I will tell you, listen, don't waste your time memorizing cis like aconitate, right? That's a garbage enzyme. You don't need that for the USMLE. Come on, give me a break. But you better know isocitrate dehydrogenase. I put a little star next to you because I just told you, because it needs a coenzyme. It needs CO2, NADH, ATP, right? Any enzyme that requires cofactors is super high yield on the board exam. Not only that, I even emphasize why it's important, what pathology is associated with this, okay? Now, yes, you have to pay before you access this, right? This is not 100% free because you have to pay for the program, right? So I'm gonna give you guys a special code today, just a special code, okay? It's called SWEET, to give you guys 50% off, okay? To get 50% of our course, all right? I'm gonna give you guys the code SWEET to use, all right? But I just wanted to walk you through our course so you guys can see exactly why this course is unique. Once you sign up, we get you access directly to our SmartMD program, okay? You get access also to our VIP WhatsApp group. It's only exclusive to only our members only. You can sign up for 15-day free trial. It's only gonna give you access to maybe about like, you know, less than a couple of videos you can access. But not only the videos are very important, if you're an IMG, we recommend you watch all these videos first. Take a lot of notes in your first aid, right? Turn your first aid into a beast. You turn into a machine, all right? And then we recommend how you go through the Cuban. And you have like, Dr. Addition, what's the Cuban? Well, just go to step 1 Cuban, for example, right? We go to the Cuban, and I'll let that load in a minute. All right, perfect. So you can pick tutor mode, right? And let's say you wanted to do pathology questions, and you pick 5, you know, 10 questions, for example, and click submit. All right. And what this is the Cuban. This is the Cuban, just like you were Cuban. All right. And so here it is. Let me give you guys a little nugget of what you get out of our program. Because some students like, what makes you guys special? What makes you guys unique? All right. We recommend to you when you're doing any questions on the USMLE, and I think Dave is taking let me see, who's taking the USMLE in 3 weeks? Damian Rowland, right? Damian, check this out. You're taking the exam in 3 weeks. Tell me you're using this skill set already, okay? Tell me you are, if you want to enroll for 3 months, right here, use the code SWEET and go to this link right now, okay? Let me put up the link for our website here for you guys, okay? SmashUSMLE.com. Okay, I'll put the link up for you guys here for students who want to enroll today. And you guys want to meet me one-on-one. Oh, I'm going to show you guys step 2. Just give me a second, okay? So check this out. So here's what you do, right? If you're taking the USMLE, right, or if you're not been using these tactics, let me show you how you use your Cuban. The first thing you do is this. You glance at the options immediately. It's going to take you 1 second to glance at the questions. And you're like, options. And you're like, oh, calcium, magnesium, phosphorus, potassium, and sodium. Well, this is going to be an electrolyte question, right? So by then, you already narrowed down in your brain, because this is what happens to you when you're studying for the USMLE. There's so much running through you guys' mind. A lot of information is running through your brain constantly. You're like, oh my God, is this neuro? Is it going to be a biochem? I'm not sure if it's micro. Oh my God. No, stop that, guys. Just glance at the options. Okay, this is sodium, potassium, phosphorus. Okay, good. The next thing you do is look at the last line of the question. Which of the following minerals is most likely responsible for this patient's symptoms? Now, if you don't know how to read an MRI, right, and you don't even know what this looks like, you're like, I have no clue what this image is, fine, good. But did you see what I just did? I just highlighted the last line of this question, okay? Always do that. Now, the next thing you do is, okay, if you still cannot answer the question, go back to the beginning. Let's read this question together. We got a 55-year-old man, right, who smoked for 35 years and having seizures. Great, awesome. That's the chief complaint. Every clinical STEM has a chief complaint, guys. This is how you're gonna write. When you guys become an attending and I pick up the phone and you're a cardiologist and I'm gonna be like, let's see, Miriam, hey, listen, you're a cardiologist. You're gonna be another line. I'm gonna say, Miriam, I've got a 45-year-old male with a history of diabetes, hypertension, hyperlipidemia, presents to the ED with chief of chest pain. Patient says chest pain started about 3 days ago and chest pain has been radiating to the arm and the back. Patient has nausea, vomiting, and diaphoresis. EKG shows ST elevation in leads 2, 3, and AVF, 1 and AVL. Troponin is elevated. This patient is having myocardial infarction. I think you need to take him to the cardiac catheter lab. That's how you're going to be talking to your own fellow physicians in the future, guys. So this is how the boards, they're training you indirectly in the future to see that your patients are going to be in case format, but in the real world, that's how you're going to talk to your clinicians. Now, let's look at this case. Before today, he's never had any seizures, so that's good. His plasma osmolarity is 250 milliosmoles per kilogram. MRI is taken and shown above, okay? MRI shows generalized cerebral edema. So they even tell you what this MRI is. So some of you guys are like, oh my God. Of course, if it's toxoplasmosis, they're gonna show these tiny little ring-enhanced lesions, right? And you're gonna be like, oh man, that's toxoplasmosis, but this is not toxo. This is cerebral edema, okay? You see those little gray matter changes right there. That's edema around the brain, okay? That's not good. So you got a patient that's having seizures with a serum osmolarity. So let's say you don't know what the normal osmolarity number is. So you type in osm, okay? Osmolarity, okay? That's blood. Let's see if we can find that in here. Okay. So normal serum osmolarity is like around 290, okay? 290, around 290 milliosm. So here's the deal. Look at this patient. What do you guys think is wrong with the patient? Now, look at what I just did. I just summarized this whole entire question stem. Now, when you're reading this question, look at what I just did. I can summarize this entire question in 2 lines. 55-year-old guy with seizures that have a low serum osm with abnormal MRI with cerebral edema. That's it. That's how you're supposed to be able to answer USMLE questions from now forever and ever. If you cannot do what I just did, you're not ready to take the board exam. You're doing the question bank the wrong way, guys. You are doing it the wrong way. So what do you guys think? A patient with a low serum osm, right, has been a smoker for 35 years, is telling me this patient is a smoker. So they're telling you indirectly the patient has cancer. Probably has a small cell carcinoma of the lung, right? And now they have SIADH, right? SiADH is going to cause reabsorption of water because you have too much antidiuretic hormone. Okay? Too much antidiuretic hormone. So you're going to reabsorb, right? So what ends up happening is this is going to be a sodium problem. Okay? Sorry? So this patient has an ectopic secretion of ADH by small cell carcinoma of the lung. Now, look at what I just did of how I answered that question. The reason I brought this up for you guys, so that you guys can understand is now, let's say you got this question wrong. You didn't understand that ectopic secretion of antidiuretic hormone, right, which is going to increase aquaporin production inside the distal tubule. If you can tell me that, you don't understand physiology. This is what we train you at SmashUSMLE, guys. You do not understand physiology because you thought you knew everything about the nephrons. But look how the USMLE twists this around. They now turn it around into a patient that has a lung cancer, producing antidiuretic hormone, ectopically in the lung, small cells carcinoma, right? From a smoker. Remember, small cell central. They're always in the center of the lung, right? And then that is triggering the aquaporins to reabsorb too much water in the distal tubules, causing the patient's sodium level to drop down. So your patient is now hyponatremic. Thus, their serum osmolarity is low. Can you guys see that? Now, this is what I tell you guys, okay? When you guys are studying for the boards and you're doing your Q-bank and you're like, oh my God, I really don't understand all this concept. What I recommend is listen. Take your time to read the correct and incorrect answer choices. I don't know if you guys can see my screen. Can you guys see my screen very well? It's a little blurry on this side, okay? All right, but that's how you do the question bank. That's exactly how you do the question bank. Now, the question bank is very, very important. It's a learning tool, guys. It's a learning tool. And what I need you to do is basically use it to study. Look at your question bank as if you're reading or watching a video, okay? That's how I want you guys to see your question. It's like somebody teaching you. So don't skip the steps. Read the correct and incorrect answer choices, okay? Read the correct and incorrect answer choices so that you guys can be able to understand what's really important. And not only that, getting the questions right, okay? You need to be able to know why the question is right and why the question is wrong, because that's how you're gonna be able to understand all this concept, guys, okay? All right. So, all right, do you guys understand what I'm saying? So now always use that highlight function, okay? And then at the end, look at the education objectives. Sodium is a primary mineral that contributes to plasma osmolarity. Movement of water into the intercellular fluid in order to equalize osmolarity account for cerebral edema and seizures, right? Remember, now I can twist the same question again because I just told you that a patient has hyponatremia. Hyponatremia will cause seizures. So when you're reading fluid and electrolytes and you read that section in your first aid that says hyponatremic patient develop seizures, don't forget that because if a patient that has SiADH will develop seizures if they have lung cancer. This is called integration. This is what we teach you at SmashUSMLE. Okay, guys? This is why this course is totally different. It's nothing like you've ever seen before, all right? Okay, now I've given you a little trick. I'm gonna keep the rest for you guys so that you guys can understand. So let's end this for a minute. Let's end this for a minute, okay? All right, so now you know how the Q-bank works. Not only that, we have flashcards, right? We have flashcards to help you study. So now let's say you're not working or you don't want to, you're taking a little break. You can just go here and look, hey, what's Addison's disease? Well, that's aldosterone deficiency, right? Deficiency of aldosterone and cortisol leads into hypotension. We can have a whole lecture on aldosterone and cortisol. But do you understand the hypothalamic pituitary adrenal axis? Because this is the same pathway they're gonna test you on 21 hydroxylate, beta hydroxylate and 17 alpha hydroxylase deficiencies. Okay, guys? This is really, really crucial. So now let me introduce guys to the master class. All right. For some of you guys who don't know that we do have a master class, let me stop sharing this for a second. Okay. We have a master class in our program, okay? So if you wanna come to a live session and see me teach you guys live, we do that here at SmashUSMLE.com. Now, the master class is unfreaking believable. It's a phenomenal, all right? Because what we do in the master class is we have all the students coming in, okay? And you sign up for it in advance. Usually we do it every week here at SmashUSMLE, and we go through cases. We literally go through cases here at SmashUSMLE, because I'm gonna grill you, I'm gonna pimp you, I'm gonna ask you questions, and listen, don't feel bad, don't feel bad. The students that come to our masterclass are like, they are raving about this. And if you don't believe me, let me show you this. Let me show you what our students are talking about when they come to our masterclass, okay? All right, let me just give you an example of exactly what you get when you come to the masterclass. And this is what students, I didn't write this. This is what, this is what students are saying when they come to our masterclass, okay? These are IMG students, medical students here in the US who come to the SmashUSMLE Review Masterclass. And we have another one coming up next week, by the way. It's our pharmacology masterclass. So check this out. Let me share my screen real quick. Let me share my screen so you guys can see me. Let's share my screen real quick. All right, perfect. Look, this is a class. This is one of our students. This was just June 13th. So this is just literally about last month, right? This is Dr. Justina. I really found the masterclass amazing, okay? Dr. Adesina is really passionate in making us great doctors. The high yields that he provides us with, enabled us to focus more on exam-oriented questions, and at the same time, prepare us to take care of our patients well. He provides honest advice and are really, really practical. Even before this class, of all of you YouTube, all of the YouTube talking of how to study for the boards, I find his best and beyond comparison. Thank you for what you're doing. Please keep it up, okay? Look, here's another one from Dr. Destin. Dr. Destin, he said, these master classes are everything and more. They are jam-packed with so much high-yield info. It is a must-watch for every topic. Dr. Adesina is so knowledgeable. Not only does he focus on what we need to know to pass this exam, but also incorporates clinical jewels in order for us to become great doctors. It's very obvious how passionate he is about teaching. He wants everyone to do well. With the several motivation videos sent during the week and his willingness to assist you anytime makes me feel like I have a teacher who really cares about my success. I'm lucky to have found this program. Listen, this is from our students. I'm not even making this up, okay? All right, I'm gonna put the link for you guys to check it out yourself. Yeah, okay, let me put the link right here for you guys, okay? When you come to the masterclass, for example, okay, and I'm gonna put up the link for the masterclass for you guys. If you guys never been to our masterclass, okay, this is the link just in case you're interested in the masterclass. All right, you go to live class, SmashUSMLE.com, okay, to join the live class, okay, right here, okay, and then you sign up. All right, listen, this is the best masterclass you are ever going to attend in your life. We spend literally 4 to 6 hours of high yield packed info, going through first aid, going through all this content so you guys can crush the board exam, literally, all right? It's gonna be case format. We're gonna go to cases, we go through pathology, pathophysiology, and I break it down for y'all step by step. Listen, you don't want to miss this stuff. I'm telling you, like, I have spent the last 10 years going through USMLE prep. Okay, every year I go through first aid cover to cover to make sure we're bringing the latest updated content, all right? I want you guys to join me in the next master class if you're interested. If you want to get direct access to me, you want to be able to be on the phone, be on our VIP WhatsApp group, listen, like I said, we give out a lot of free stuff. You get a free ebook if you come to our master class. You get a free copy of my exam day ritual. Listen, we prepare you for before, in the middle, and after, okay? Which means before, hey, hi, Shailesh, how you doing? This is Dr. Adesina, how you doing? Welcome to the show, okay? Not only do we, listen, I'm gonna give you an ebook on insider secrets on how to study for the USMLE, okay? You're gonna get a copy of that, all right? And then, not only are you gonna get that, you're gonna get a copy of our NEQ. Absolutely, we have our QBank. Listen, I think you probably just missed it. Listen, let me show you our QBank real quick. Okay, we just literally went through the QBank and we just did a question inside our QBank. This is our QBank. We have about 2,200 questions for step 1, 2,100 questions for step 2. If you're interested in our program, listen, just go to SmashUSMLE.com. I'm gonna put the link back here again for you guys. We are doing a special right now to give 50% off, literally 50% of our program. Let me just grab the link for you right here, okay? And you just use the code SWEET, all right? Use the code SWEET to get 50% off, all right? Use it to get 50% off because this is just a one-time special, all right? Now, this is our QBank right here. You just go to tutor mode. All right, you pick whatever course you want to study, pathology, micro. You pick 5 questions, whatever. You can do up to 40 questions. Okay, and right there, that's the QBank. And I just literally went through it for you guys. Listen, when you want to start your QBank, you can join us for the first time. My name is Dr. Adesina. I'm a board certified ER physician. I've been teaching USMLE prep for the last 10 years. I practice medicine in Houston Methodist in Houston, and I'm an ER physician. Listen, I teach USMLE prep every week through our masterclass online, live online. You literally have direct access to us, all right? And I always recommend when you're doing questions, guys, always use the same strategy over and over and over and over. This is what we teach you something called a SmartMD training course here at SmashUSMLE, right here. Check this out, okay? You look at the options first, okay? You look at the app first. You look at the options first right here. And you're like, oh, wait a minute, this is a bunch of electrolyte questions. I'm not really sure, but, because a lot of students, this is how they always do questions. Even on the actual exam, they start at the beginning. They start reading all the way and they go all the way down. No, that's a bad way to approach your QBank, guys. Don't ever do that. That's a big mistake. Don't make that mistake. You know why? The USMLE exam itself, they are designed as it's an exam strategy. Look, on the USMLE, they have all these little tools. They have a mark tool. They have a lab tool, right? They have notes tool. See that? They have a calculator. You really think the guys that write the question bank put that in there because they're bored to death? They even put an option for you to zoom out for people that have vision problems. The reason why they did that is because they put all these tools in place to help you maximize your experience when you're taking the board exam. So what I tell students is don't ignore the tools. They're there to help you. Now, let me show you how you use the tools, right? So remember, there's an option to cross out, right? We just went through this question, but we're going to go through it again. Every question on the USMLE, all right, is trying to test you on one concept. That's it. Not 2. I don't care if there's 10 options here. They only want you to know one concept. It could be a micro question. It could be a genetic question. It could be a pathology question. It could be a cardio question. But it doesn't matter. The fact of the matter is they just want you to know one thing. That's it. So let's look at what is the one thing they want me to know in this question, right? Now, the first thing I do is, hey, let me look at these options. The options, let me tell you why I always recommend you guys look at the options first. The volume, right? The sheer volume of information that you guys must know to study for the USMLE is ridiculous, right? It's a lot of information, cover to cover, right? Now, if you're studying for step 1, this is the ultimate book you need. If you're studying for step 2, this is the book you need, guys. Yale G First Aid. I know, let me put them next to each other right there, okay? This is step 1. This is the book you need for step 1. This is the book you need for step 2. We literally give you free information here on buyers, things that will help you. This is better than Master the Boards. You're like, what? Are you serious? No, that's not possible. Yes, I tell you. I repeat what I just said. This Yale G book, Crush USMLE step 1, step 2 CK, and step 3 is better than Master the Boards. You know why? It covers everything. Everything you need to know for step 2 and step 3 is in this book. Listen, Dr. Yo Gong has been publishing this book for the last 5 years, and students are raving, they're going crazy. If you sign up for our step 2 course, you get a free copy of this book. Yes, I said that. You are going to get a free copy of this book if you sign up for our step 2 CK course. That is how confident we are in our program, okay? We're giving you a free copy of this book, okay? So do me a favor, listen. This course is not your typical course. It's not Pathoma, it's not DIT, it's not USMLE RX. We are invested in you first. I have so much passion because I love to teach students. I want to see you succeed. I want you to take your board study to the next level. I want you to become a better doctor. Listen, we don't train test takers here at SmashUSMLE, guys. We train you to become a better physician because you one day, the knowledge you're going to get from this course is going to help somebody take care of somebody's family, somebody's father, somebody's children. Listen, when I go to the room in the hospital, right? I'm sitting in the emergency department. Anything can walk through that door. I don't care what it is. I can take care of it, right? Because I got the right training. I'm board certified in emergency medicine. I can take care of anything that walks through that. But you know what the only reason also I can do that? Because I have the knowledge and the skill. I got the knowledge and the skill. And that's what I try to train every single person that comes to a SmashUSMLE. I said, listen, I'm here to give you the knowledge. When you get to residency, they will give you the skill. Okay. Let me back up a little bit. When I was a resident in residency, my attending told me one thing one time. He said, Leke, The eyes cannot recognize what the mind does not see. Let me repeat that. Your eyes will never recognize what the mind does not see. So let's use that concept for example. So the same questions that we're just talking about. Take a quick glance at the options. This is a bunch of electrolytes, so I'm not sure. It could be anything, right? But the next thing I do is read the last line of the question. Always do that. You know why? Because on the USMLE, they will give you this long ass line that has about, like 5, 6, 7 lines long with lab values, images, like video, audio. And guess what? By the time you read the question from the beginning to the end, you're so tired. They do that on purpose. But if you read the last line, sometimes you can answer the questions. Now, if you guys were radiologists and you know what this looks like, this is cerebral edema, you actually can answer the question. But they don't expect you to be, you're not a radiologist, you're a medical student, right? You just finished medical school. So a radiologist spent 5 years of training to be able to read these things. But there are some important ones you must recognize. Like if they put toxoplasmosis, glioblastoma multiforme here on the CT scan, or a patient that have temporal lobe encephalitis from HSV infection, you better be able to recognize that stuff, guys. You better be able to recognize. This is not a joke because that's an important pathologic finding. And even if you're not a radiologist yet, if I put that in the question stem, I'll give you more information anyway, right? You'll be able to recognize. So here's another piece of advice. There are really important images you must know for the boards. CTs, MRIs, ultrasounds of gallbladders, patients that have cholecystitis with, pericholecystic fluid, gallbladder wall thickening with gallstones. You better know that. I mean, come on, that is easy. They want you to know that. If your patient has aortic dissection and they put up a CT scan on your board exam, you better be able to recognize your patient has aortic dissection. Okay, guys? So you'll be able to recognize that, which is fine, but majority of the images are supposed to aid you. So sometimes students are caught up and try to read the entire Robbins pathology for step 1. And I'm like, are you out of your mind? Don't waste your time reading Robbins. Robbins is for pathologists. Those are the guys in residency, okay? That's too much information, okay? Now, when we read this last line, it says, which of the following minerals is most likely responsible for the signs and symptoms in this patient? And then you're like, okay, I still don't know. Okay, fine, let's start from the beginning. A 55-year-old male, smoked for 35 years, is experiencing seizures. Before today, he's never had any seizures. His plasma osmolarity is 250 milliosm per kilogram. MRI is taken and shown below. MRI shows generalized cerebral edema with no lesion. So they're even telling you exactly what's on the MRI, guys. They already told you. Now, look at what I just did. When you highlight, please, always use this highlight function. Every single time you do your QBank, get used to it. Because this is what happens to students. They will not use the highlight function. They will read a question that has about 4, and most USMLE questions are longer than these, guys. They will read it all the way down to and then they don't know the answer. And guess what you do? You go back on your test to try to read it from the beginning again. And you're still looking for what is the correct answer. Now, the problem with that strategy is that you're going to waste time on the exam day. When you take your actual USMLE on the exam day itself, your anxiety level will go up a notch because once you pick your answer, this is not UWorld anymore. This is not SmashUSMLE QBank anymore. This is not USMLE RX anymore. This is the real deal. Whatever you pick is your final answer. Have you guys ever watched the show, one of the shows on TV that they will ask you a question and be like, who wants to be a millionaire, right? And they always ask you, is that your final answer? And you have to say, yes, that's my final answer. Yeah, that's what you're going to be doing the USMLE exam. And you know what gets students to get low scores on the USMLE? Do you guys really think the students that don't do well on the USMLE are basically students that are not smart? No. It's wrong questions, picking the wrong answers. That's what gets you a low score on the exam. Okay? Picking wrong answers is what kills you on the exam. But how do you pick wrong answers? Because you don't have the knowledge. Because when I look at this QBank right now, I'm saying to myself, why does this patient have a low osmolarity, right? So you need to be able to answer that question because it's called code switch. Now, a code switch is what we teach you in the program to tell you, for example, on the USMLE, they'll give you vital signs. Your patient's heart rate will be 140. Their blood pressure will be 60/40. What they are telling you indirectly is your patient is hypotensive and tachycardic. You can explain that physiologically because anytime a patient have hemorrhagic shock, hypovolemic shock, septic shock, they are going to be hypotensive. You're going to activate the hernia nerve right here, right next to the carotid artery. It's going to send the reflex tachycardia down to the heart is going to increase the patient's heart rate, right? The patient's heart is going to go up. It's going to get reflex tachycardia. Why is the body doing that? Because your patient has decreased cardiac output, and you have to undergo reflex tachycardia to basically vasoconstrict your total peripheral resistance and also increase your cardiac output to try to raise your blood pressure. That is the physiologic explanation. Okay? So that is my point. Now, I just explained to you an abnormal vital sign to put inside your question stem for you. This is how I train. We train you like this to think like a question writer, because the question writer is not trying to trick you. We will give you all the facts. Every single fact you need to do well on the USMLE, it's right there. But the problem is, if you can't see it, the eyes doesn't recognize what the mind does not see. If you have a knowledge deficit, right? The reason why students do poorly on the USMLE, they have knowledge deficit. And I tell them all the time, you have content deficit, period. Okay? The only way you're going to overcome that is to understand stuff. The problem is students are memorizing. Yeah, listen, 30% of the concept on step 1 is memorization. I mean, think about it. You just have to memorize the gluconeogenesis pathway. You just have to memorize the exophosphate shunt pathway. You just have to memorize the fatty acids, pathways. But then, if you look at those pathways in general, they are just disease process in the way that if one of the enzymes is missing, if that one enzyme is not working, guess what? The whole pathway shuts down. Okay? Now, that's a great question, I am Hamed. The live masterclass is separate from the SmashUSMLE subscription, because we have students in our class, they buy the online subscription, the SmashUSMLE subscription, and they come to our live masterclass, because the live masterclass is live. It's a live class, right? So it's not, it's not like a pre-recorded lecture. I'm gonna be here like that with you guys one-on-one, and I'm gonna be asking you a question in the live masterclass. You know what? Let me see if I can pull up a sample so you guys can see exactly what our live masterclass looks like. Give me a second. Let me show you something real quick, because since you guys are live watching me right now, why don't I give you guys a snippet? Because some of you are like, what makes a live masterclass a little different? What is Dr. Adesina talking about? Okay, let's find it right here. I think we have the live masterclass available just for me to show you. All right, but my point is, and I'll let that load a little bit. It's just coming up. Once it loads up, I'll pull up the PowerPoint so you guys can see. Okay, give it about maybe like 2 minutes. Anyway, so look at what I've done with the Cuban, because I'm gonna go back to the Cuban. Okay, so you should, every time you do a Cuban question, this is what you have to be able to do for me. You must be able to summarize for me in one line what the question is asking and exactly what the fact they want you to know. Tell me the clue and tell me the answer, period. Look, a 55-year-old guy, smoker, has seizures, low osmolality, cerebral edema. That's it. That's all this question is saying. Guess what? The answer is sodium. Why? Because you need to understand. Let's go to first aid. Let's go. You know what? Let me pull up my first aid real quick. I got my own first aid right here. So, some of you guys might be like, oh my goodness. Yeah, I have my own first aid, right? Let's pull up first aid into the mix, because, and you're like, where is that in first aid? Where is that in first aid, right? Because Dr. Adesina, I'm not sure. How did you get that answer and how did you figure it out? Well, it is in first aid. The problem is when you read first aid, you just forget it, or you don't recall that it was there. So let's go to respiratory. All right. Let's go to respiratory in first aid and find where this question came from, okay? Let's find where this question came from so I can show you why this question was so important, okay? All right, I'm about to pull it up right now. Just give you 2 seconds. I'm going through my first aid right now. Listen, I've opened first aid for so long that I know pretty much every page in the book. That's how you should be when you're taking your boards, okay? So we're gonna go to small cell carcinoma real quick. Small cell, okay, oh, perfect, right here. Oh, there you go, found it, perfect. Okay, look here, guys. Let me share my screen. Let me stop sharing this. Let me share my first aid for you guys. All right, this is how we roll here. Okay, this is exactly okay. So here's first aid, right? Look at first aid. First aid says right here. Let me highlight it for you guys so you can see. Small cell carcinoma is an UT cell carcinoma, right? It's central. It's right in the center. All right. Okay, good. But it may produce ACTH, causes Cushing syndrome, causes SIADH. Wait a minute. Stop. Listen, if you just read first aid and you skipped and you forgot that small cell cancer can produce ACTH or SIADH, and you because it's impossible to read this book, right? Look, They only put one word, SIADH. How are you supposed to remember SIADH is associated with small cell if you really didn't understand the pathophysiology of how syndrome of inappropriate antidiuretic hormone can be caused by small cell carcinoma, right? So we're now putting a case for you, and guess what? We didn't even tell you, we didn't tell you when we're telling by the patient exactly what's wrong. But look at what first aid said. First aid didn't even really mention a whole lot here, but if you come up right here, lung cancer is the leading cause of death, cancer death. But it says right here, look, it says small cell carcinoma, right? Most of them, let's find where that is. Oh, look, small squamous cell and small cell carcinomas are central and are often caused by smoking. So you're telling me first aid wants you to read this and understand that this and SIDH is related? Come on, guys. This is the reason why you guys forget all this information. Because you're gonna read this first paragraph, right? And then by the time you get to the next paragraph, you already forgot the association between squamous cell and small cell carcinoma with syndrome of SIDH. So now that you guys have seen where they got the question from, when you read this, you're gonna come into your first aid and take notes right here. You're gonna be like, oh my goodness. Because did they mention anything about sodium here? Exactly. Did they mention anything about hyponatremia here? No. So the only way you're gonna remember this is let's go back to endocrine. Let's go back to endocrine. All right. Let's go back to endocrine. Let's see, 420, maybe page 420 or something. That's let's try 385. I'm trying to find where this is. Okay, this is GI and 400. Let's try this. Okay, we're almost there. All right, let's find. You guys can see my screen, right? All right, GI is pretty big. Hem-onc. I think it's after cardiology. Cardio is, I think, cardio and endocrine. So let's try 300 first. Cardiovascular, and let's do 320. All right, boom, almost there. Almost there. 330. Not there. 350. Okay, good. Look. Oh, perfect. Look. So when you guys go back to endocrine, and you probably read endocrine maybe 2 months ago, right? You probably read endocrine. You're like, oh, endocrinology, all this is blah, 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 blah. And let's see. SIADH. Can we find you? Where are you, buddy? Oh, right there. Look, right here. Check this out. Syndrome of inappropriate antidiuretic hormone. It says excessive free water retention, euvolemic hyponatremia, right, with continued urinary sodium excretion. The urine osmolality is greater than the urine osmolality. Good. Look right here. SIADH is caused by lung cancer. Ectopic ADH production. Did you see that? Which means while you're reading endocrinology, you should be thinking about respiratory system, guys. You should be thinking to yourself, because in the Cuban, this is exactly how we're going to test you. This is what we do in our masterclass. You guys understand what I'm saying? So when we do masterclass, I'm going between endocrine, GI, nephro, neurology. It's called integration, baby. This is how the board exam is designed to test you. But the problem with a lot of students is that you guys are learning in a linear fashion. You just, oh, let me read endocrinology, and let me get through respiratory, let me get through GI, and you keep forgetting it's the human body. You're reading about yourself, okay? Oh, absolutely. Our questions in the Q bank is as difficult as RX and UWorld. Period, hands down. I mean, I just give you a perfect example of that, okay? That's Shailish, okay? They're very difficult. We wrote them on purpose so you can see exactly, right? So let me go back here and let's go back to our Cuban. Let's go back to our Cuban. All right. Let me go back to the Cuban. Let me stop sharing this. Let's get out of first aid. Okay. Let's go back to the Cuban. Okay, guys. This is what we do here. All right. So the master class, it's about 4 to 6 hours of high yield, high impact. Oh, I think we were trying to go through the master class, just give you a sample example a minute ago, okay? Let me see if I can pull that up. Yes, you're asking if they're arranged in levels. They are arranged, yes, let me go back. Oh, maybe I didn't show you. Let me suspend this. I think you're asking a question. Let me just answer your question real quick, okay? Now, they're not arranged from easy, medium to difficult. No, it's all basically all combined together. You know, because the question is, why are you looking to do easy questions first or try to do medium questions or difficult questions first? There's no rhyme or reason why you should be saying, oh, this should be a question. I want to do my easy questions or the medium questions first, because that kind of gives you a notion of conception to lower your bars every time you try to learn information. because there's no reason ranking questions by difficulty, because the fact of the matter is all that matters is you need to know that information in your brain. Because what you're trying to tell me is if it's a difficult question, that's probably for somebody who wants to call 260 and it requires me to learn a lot more information. Yes, it might take a lot more work for me to put in, but why do you, okay, let me give you a perfect analogy. So in the ER, I have to intubate patients when they're altered or they're opioid overdose or they're septic shock and they're getting, basically anything that causes you to be comatose. And when I was a resident, we did something called the difficult airway course. There was regular intubation, and then we had to do this difficult airway course that teaches you how to recognize a difficult airway. And I remember I took the whole course. Okay, Mariam, it's so good to see you. Hey, listen, don't forget to go to, let me put the link for you guys again, all right? If you want to just get started for free, like I said, just go to, it's free trial. To get a free trial for our account, I just put all the links for you guys here so that, you guys don't miss out on anything like that. That's for our free account. If you want to sign up on SmashUSMLE, just go to SmashUSMLE.com. Remember, you guys can use the code anytime. The offer is only going to be available till tomorrow. This is 50% off that we're offering. So this is just a one-time offer. I decided to come on live today. I'm probably going to do that another one on Monday. So if you guys are available, just come on Monday. We're going to go over some free stuff again. All right. You get 3 free ebooks. You get you get access to our Cuban video lectures, flashcards. All right. You get access for direct coaching. You get to spend 1 to 2 hours directly with me when you sign up for the course, and I'm available for you. And if you get the masterclass, if you guys sign up for the masterclass, just go to live class of SmashUSMLE.com and you guys can sign up for the course. Okay. Now, so here's the deal. So this is what my attending, my senior residents, they said, Leke, listen, man, listen. I want you from now on to assume all airways are difficult, because the moment you're saying, oh, maybe this one is not difficult, you're going to run into trouble. So from now on, Shalish, do me a favor. Don't assume any content is easy. Don't assume any content is medium and assume any content is difficult. Assume all questions are difficult, and your goal is to figure them out, master them all to be able to do well on the boards. See what I just did for you? I just simplified your life for you, okay? Because don't keep ranking things. Yes, there are some things that are easy to remember, but yeah, just because it's easy for you doesn't mean it's easy for another person. So how are they able to determine what's easy for you and what's easy for someone else? Okay, it's impossible. Everybody's knowledge. One of my friends in medical school, we wrote the book on how, let me show you the book we wrote. We wrote this book on how to study. It's actually right here. If you go on there, start here. We give you free schedules, by the way, too. You get a free schedule. So if you go here to, and we also provide you with notes. I mean, this is just a full pack course, right? So you get all this access to all this free information right here, like 6 weeks schedule, 7 weeks detailed schedule, 12 weeks detailed schedules, a 6-month schedule that you can download for free. And I can show you what it looks like, a sample of that. I'm kind of introducing you guys to the course so you guys can see. All right. All right. And then we have all these notes, behavioral science notes, all right, nephrology notes that, pulmonary biochemistry, and you can download them and basically read more information. So all our lecture videos right here, see, this is a lecture on acute renal failure. So you guys can basically download all these notes. We have an app in the App Store also, metabolic acidosis, one of my favorites, okay, Mud Piles, right? So we have this, we wrote this book together when we were in medical school, How to Study for the USMLE. We're actually updating the book right now as we speak. This book right here, it's on Amazon. It has 4.5 stars. How to Prepare for the Medicals Boards. That's my name right there, Dr. Adeshina, Adeleke Adeshina as Farouk. This guy is really, really smart. He's an ER physician. And I remember, the way he studies, he's just a genius. He has a photographic memory. Like, he doesn't forget stuff. And he would tell me like, hey, Leke, do you remember Campylobacter? It's basically, a bacteria that can grow at 47 degrees. And I'm like, how did you remember that Campylobacter grows at 47 degrees? I mean, that's crazy. I can't even remember that stuff, right? But that's the kind of student he is. Imagine me trying to compare myself to him and saying, that was easy. He's going to come up to me like, oh, that was easy. I just didn't forget. And I'm like, dude, I don't remember. I forgot it. Okay. That's why you never use that easy, medium, difficult. Okay. It puts you in a bind. It puts you in a little box. Don't ever do that. Your goal is to become USMLE Masters to become a better doctor. Okay. See, all this content you guys are learning, one day you will see it live in front of you. So for example, if your patient has diabetic ketoacidosis, right, and they show up in the emergency department and you ask them questions, 16-year-old girl, history of diabetes, never use insulin, coming into the emergency department with tachypnea, tachycardia, diffuse abdominal pain, nausea, and vomiting, right? And you don't recognize your patient has diabetic ketoacidosis. You see their blood sugar is like 450, and you don't remember to order like your ketone levels to check for beta hydroxybutyrate. You don't remember to order ABG or VBG to be able to check their CO2 levels. The problem is you're going to run into trouble. You might think your patient is just diabetic, but you just mean DKA that your patient can die from. Now, let guys, okay. Do you guys know the reason why the USMLE has high yield information? Because you guys hear that word high yield, right? All the time. People are always throwing that word around. How many of you guys can tell me exactly what a high yield information is? And how do you even determine something is high yield? Because I've been hearing high yield for a long time. It's like high yield, this is high yield on the boards. Do you guys even know why that word exists? Let me see if I have anything here. Do I have any of my EKGs here? Probably not, I don't. Okay, all right. The reason why the board, it's only $99. The live class is only $99. It's only, that's it, $99 for the live class. Okay, and it's 4 to 6 hours. You're coming to a 4 to 5 to 6 hour class, guys. It's not, this is not a 1 hour lecture, guys. High packed. Let me pull up my slides. I think the slides are ready. They just got the slides ready for me. Thanks, guys. You know, I got our team on the other line that's working to get me all this information. Hey, Abe, how you doing? Let me pull up our live class. All right, here you go. Let me give you guys a snapshot, just a little snippet, okay, of some of our live course. Hey, perfect. Okay, I'm gonna stop sharing my screen and I'm gonna pull up our live course so you guys can see. Perfect. All right, great. So this is what typically when you come to live class sessions, right? You know, I'm just kind of showing you guys a little bit here. You know, I tell you about, you know, some of the codes, you know, and I always, you know, we always give you guys this to start with your goal. All right. All right. Let me give you guys some, you know, sweet little data here. Okay. If you guys don't know this data exists, this is 2018 NRMP data. And I share this in all our classes when people come to class. All right. So the guys that matched last year, 2018, this is the score. All right. Look for, and look here. Let me just kind of give you an orientation. Look right here. It says, oh, go back. No, let's go back. I want to highlight. Let's highlight. Select, draw. I don't know why it's not letting me do that. Huh, that's interesting. Okay. Oh, let me share my screen then. Let me stop sharing my screen. Let me try to do that again. Okay. All right. So check this out. Check this out. So all right. Perfect. Look right here. It says United States International Medical Graduates. Okay. You see, guys, see that? Non-US IMGs. All right. So I always put this data for all IMGs that are coming to the US, like, oh, Dr. Adeshina, what is the score I need to get into residency? Well, let's take a look. For United States International Medical Graduates means if you have a permanent residency card or you're a US citizen, okay, you live in the United States, you have a permanent residency card and you have a green card. That's what we call green card in America. Not an F1 visa, not a B1, not an L1 visa. No, permanent residency, or you're a US citizen, and you go to any place in the world to go and learn medicine. Ukraine, Poland, Ross University, St. George's, Antigua, all the schools, right? Remember, you're still a US resident. When you come back, we call it a US IMG. Okay, good. Now, if you're not US IMG, that means you just don't have a green card. You're not a US citizen, so you're coming from India, you're coming from China, you come from Italy, whatever you're coming from, you come into this country, we call you a non-US IMG. Look at the numbers. This is the average. This is the average USMLE score for students who are United States residents that matched last year. 2,200 of them matched, 1,900 did not match, pretty much 50-50. Look, for step 1, 222, that's their number. For step 2, 232, you see that? Now, look at the people that didn't match, 212 and 222. So when I tell all the IMGs that come to our program and they're like, Dr. Adeshina, you know, I scored like a 210 on step 1. Do I have a chance of matching? I tell them no. And they look like me like I'm mean or I'm crazy, but I'm going by numbers, guys. I'm going by real numbers. I'm not trying to make you feel bad. That's why I tell all the IMG students that come to our program, before you take the USMLE, come to SmashUSMLE before you make the biggest mistake of your life. Because you only get a chance to take it one time. That's it, guys. You can't take this exam again once you pass. If you get a 196, it's over. You just spent all that time, energy, work for nothing. You guys can see I'm very passionate about it because too many IMG's dreams have basically gone to shambles because of lack of knowledge. They're hanging out with the wrong people. They're going on the wrong forums to get advice. And I tell them, when you come to this program, I'm not going to lie to you. You may not like what I'm telling you, but it's the facts. I'm telling you the truth. Okay? You got a 50% chance. Maximize all that chances. Don't screw it up. Come on, guys. Come on, y'all. Seriously. Let's go. Okay? So if somebody comes to me and tell me, Doc, I got a 210 and a 220 on step 2, I'm like, dude, what are you doing? Like, what are you doing? Your number is 222, man. 232 on step 2. That's your number right there. That's the average. Now let's look at the and these are the students that are United States residents and they have a green card or US holder. Look, let's look at the numbers for students who are actually don't have a green card and do not have a US citizenship. Please do me a favor, look at that number right there. Look at this number right here. Look, 234, that's your number. Yeah, that's right, you heard me. You heard exactly what I said. 234 is your number to get into residency if you want to match as a non-US ING. 240, step 2, that's your number. I'm not making these numbers up. Look, this is the data from the NRMP of last year. Last year's data. This is new data just recently published about 6 months ago. And I'm showing you the data right now. Look at the people that did not match. Look, right there, 221, 228. Please don't get that score. So when I tell you to come to SmashUSMLE Masterclass, when I'm telling you to take the course, when I'm telling you to follow all the instructions I'm telling you, this is your number right there. So here's what I tell everybody, aim for 245. If you want to match, look at the people that didn't match. 2,910, 3,269 people matched. How did they match? This is the number that got them in. This is a numbers game, y'all. This is a numbers game. So I'm sick and tired of students who think there's a shortcut to the process. It is difficult, but it's doable. I'm telling you, you can do this. You can do this. You just need to follow strategies. You just need to take the advice that I give you, and our team gives you all the resources to maximize your chances of getting that board scored. So when I tell IMGs, like, oh, Doc, I've been studying for about 7 months. And what are they doing? They're like, oh, you know, I take a break, I come back. I'm like, what are you doing? There's something called the law of diminishing returns. Do you guys know what the law of diminishing returns is? Listen, over time, as you guys start to study, right, this is what is going to happen. Let me show you exactly what happens to students. At the beginning of your study, right, let me clear all this out. All right? At the beginning of your study, your ability to retain information is going to be very high, right? You're going to be going up like this, up, 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 up. At some point, you're going to plateau, and then you're going to start dropping, okay? And dropping and dropping, okay? So the longer you study, the lower your performance. The longer you study, the lower your performance. Now, it's not always true for everybody. You see people that post, I studied for 1 year before I got my 240 in step 1. There's probably a lot of factors you have to ask them, like how, were you working? How many hours a day were you studying? Did you study for 8 hours or 10 hours a day? Did you do a dedicated study period? How many question banks did you go through? There's so many things people don't tell you. They just tell you they studied for 1 year and then they got a 240 on step 1. Come on, guys. Come on, seriously. Let's be honest with each other here. Let's face reality and say to ourselves, listen, tell me everything you did and don't shortcut the process by telling me you took a year to study. Okay? If somebody has a job, they have 2 children at home and they're studying 4 hours a day and it took them 1 year to study, that's different from you. If you don't have a job, or maybe you have 1 job, but they have 2 jobs, you don't know. So many factors for IMGs, and I keep telling them, and people don't listen to me. And I'm like, don't compare yourself to Joe. Don't compare us to Shaisha, whatever, because their life is not your life. You need to focus. You go in like your life depends on this, guys. You have 1 shot, right? I mean, back in the days, people used to get married once and everybody live, fine. But today, everybody get married and break up in the next month. But, think of this as a marriage. You work for a whole year just for 1 day, a 6-hour, 8-hour event, right? That's what people do for weddings, right? Shailesh, where are you from? Are you from India? Shailesh, are you from India? Right? So, I mean, I should probably not assume that, but by your, Argawal, my neighbor's name is Argawal. That's why I kind of, right? The reason I'm telling you this stuff is because India, right? See, I got it right. So the reason why I'm saying this, guys, is because you need to understand. If you didn't go to school in the United States, there's so much knowledge gap you have. You're very smart. You're very intelligent. You probably memorize much information that you need when you went to medical school in India because it's very difficult. But the USMLE is just a different animal. It's just a different beast. You can do it. You just need somebody who's been in the system to teach you it. That's all it is. That's the only thing you're missing. You need a program who just doesn't look at you like a number. That's what happens. A lot of IMGs, they go to Kaplan, right? You're just a number in Kaplan, guys. So David's asking, is US clinical rotation advantage for IMGs? Absolutely. Why not? If you listen, I get students all the time that come and do rotations or like they shadow me. They don't, they can't shadow me for more than 30 days or they have to pay for that. But if you come and shadow me in the ER, for example, that's your opportunity for you and I to meet one-on-one and you show me that you know your stuff. Because if I tell you, listen, Dave, go into that room and assess that patient, come back and tell me what your HPI is, your history of present illness, right? Tell me your review systems, tell me your physical exam findings, and come up with your differential diagnosis and how you're going to manage this patient. Now, you can't hide that, right? There's no way of hiding that because it's either you know or you have no freaking clue. So when you go in and you come back out and I'm like, Dave, okay, what do you think is wrong with the patient? And you kind of give me a differential diagnosis. I think the patient has a fracture. I think the patient has gastroenteritis. I think the patient has appendicitis or pancreatitis. And I'm like, okay, let's talk about pancreatitis. Tell me the pathophysiology of pancreatitis. Tell me all the things. I get SMASH mnemonic in first aid that you memorized. Did you remember idiopathic, right? Ethanol, right? I get SMASH, gallstones, ethanol, trauma, right? Scorpion sting, mumps, right? ERCP, hyperlipidemia, and drugs. Can you tell me all that? And if I ask you those questions and you can't answer that, I look at you like you have knowledge deficit. Because you think a patient has pancreatitis and you can't come up with a differential of what could be possibly causing the patient's pancreatitis. Because the next question, if you think it's alcohol, then I'm like, did you ask the patient, does the patient drink? And the patient said, I drink every day. And then we check the alcohol level. Even the alcohol level is normal, right? That's our cause of our pancreatitis right there. But if you ask the patient and the patient said, no, I don't drink, but I have abdomen up in the right upper quadrant and we're doing a right upper quadrant or abdominal ultrasound and they have gallstones and I'm like, dude, that's the cause of your pancreatitis. So that's the next step. What is the next step I'm going to order? If you tell me that, okay, I'm like, oh, tell me what the order is. I'm like, I'm going to order amylase and lipase level. And then I'm like, okay, good. You want me to order amylase and lipase level? What are you looking for? Well, in pancreatitis, patients have, inflammation of the pancreas. You're going to have chymotrypsin and you're going to have amylase. So it's going to be really, lipase is more specific than amylase. Lipase is basically what breaks down your lipids. This is how I'm going to test you as an IMG because I want to know if you know your stuff or you don't. Because you're coming in here telling me you know a lot of information. Show me. Come on. Show me stuff. And then if you show me that you know your stuff, I'm like, that is a good resident. You're going to be a good resident for our program. You know your stuff and you have good clinical acumen. You guys understand where I'm coming from now? This is why I get passionate about this stuff because some of you guys may think, oh, this is medicine, guys. Come on, y'all. Okay, that's your number, guys. Non-US IMGs, 234 and 240. This is the reason SmashUSMLE is different. When you go to Kaplan, they just take your money, they give you a bunch of books, they give you their Cuban and their videos, and they'll teach you a bunch of information, but they could care less about you. If you fail the boards, they don't care. They're just a brand. This is personalized one-on-one, guys. You get access to our SmartMD VIP group right here on my phone, okay? You are going to get direct access to our VIP WhatsApp group. This is exclusive, only to the students who sign up for our program. That's it. You get one-on-one advice. I'm sure you guys can see it. Look, we have 10 likes right here right now, 10 likes, and I've been talking for the last 109 minutes straight. You know why? You guys know these are facts, and these are true. Because we don't mince information here at USMLE, SmashUSMLE. So you go to SmashUSMLE.com, sign up right now. It's the best investment you're going to have. Email, listen, I'm going to put my email right here, okay? This is my email address, dradditional@ftplectures.com. You want to join the program, shoot me an email. If you want to, just let me know. Okay? Because we're going to be wrapping up right in a minute right now. Okay? I'm wrapping up the show because I'm going to be back on Monday morning again for another session like this. Okay? The masterclass is unfreaking believable. It is ridiculous. It's literally, listen, this is, I'm just going to give you just a snippet, okay, because we're going to share all the information with you right now, okay? These are all the bonuses that comes with this masterclass. Listen, you get free ebooks, you get the notes, you get an insider security book, you got exam day rituals, you're going to get a free copy of First Aid, you get access to our SmartMD course, you get a free account. This is, listen, save this number. I want you guys to take a screenshot of this right now. Take a screenshot, SmashUSMLE.com. Take a screenshot of that right now, okay? You don't want to miss that. That's the best opportunity. Listen, when you sign up for the course, you get direct access to me, period, okay? That's my personal cell phone number. If you sign up for our course right now, you're going to get direct access to me, okay? If you're interested in call me, okay? If you're not interested, don't call me. Don't waste my time. I don't want to waste your time, okay? But if you're really, really interested in taking your board study to the next level, all right, I'm putting this right here for you guys. Okay, somebody's asking for cardiology step 2 videos. Okay, so you guys should take a screenshot right now. Okay, and if you want to join our course, you just come on over. Okay, so I think Zadie says, this is not an ad. This is not an ad. If you're just joining us for the first time, okay, we've been talking about, I don't know if you just joined us right now, Zygist, okay? We've been talking for the last 1.5 hours on how to study for the USMLE. Okay, now we only take serious students in our course, and the reason is that we don't mince words. We show you exactly how to study for the board exam. Now, I'm only introducing guys to the course so you know about SmashUSMLE Reviews. And if you've not heard about us, we've been around for the last 10 years training a lot of students for the board exam. Okay, so if you want to join our course, it's up to you. All right, we give you value first year, and then you pay for us, okay? This is not like, oh my God, and somebody's trying to pitch you for a course, all right? If you want to join the course, it's totally up to you. That's totally optional. But I challenge you, if you want to take your board study to the next level, you join the program, and then I show you exactly why this course is not the typical USMLE class. Now, let me show you our step 2. Let me kind of, so this is typical. We'll go through cases, right? It's going to be a 35-year-old female that presents to the outpatient clinic, dyspnea, hoarseness, fatigue, hemoptysis. Patient's pulse is irregular. Past medical history is significant for rheumatic fever. Cardiac auscultation reviews delayed rumbling, mid-late diastolic murmur after an opening snap in the mitral here. What is the likely diagnosis? Mitral stenosis. Now I'm going to ask you guys to answer those questions. And then the next question is, what's the most important intervention known to alter prognosis? What is the symptomatic treatment? And I want you to answer that question. So you told me you already know the information already. Come on, answer the question. Right? So here's the patient that came in irregular. The question is, why is that patient has an irregular heart rate? Why is the patient has an irregular? That's an atrial fibrillation. Why? Because they have mitral stenosis from rheumatic fever. So what happens to the left atrium is the left atrium starts to push down against a stiff valve, dilate the left atrium, and boom, your patient is going to AFib. Surgery. All right? You can give them beta blocker to decrease their preload to improve symptoms. And then we talk about the effect of the pathology on pulmonary circulation. What's going to happen to your patient who has atrial fibrillation secondary to the effect of mitral valve stenosis, right? Who has basically rheumatic fever, right? I already told you, increased left atrial dilation is going to lead to congestive heart failure. And the patient is eventually going to develop a right-sided heart failure, okay? And I already told you the patient is going to go into AFib. And why does the patient have hoarseness? You're going to have to be able to answer this question when you come to the master class because you think you know this information. We're going to grind it back into your brain. Why does your patient have hoarseness? Because they have atrial fibrillation secondary to rheumatic fever, what's causing mitral valve stenosis. You better know that it's because it causes hoarseness from the compression of the left recurrent laryngeal nerve. Welcome to the master class, guys. This is what we do here at SmashUSMLE.com. Okay? Now, let me show you guys our step 2 course. All right? Because I think we have a student right here who wants to see our step 2 videos. There's an overlap between our step 1 and our step 2 videos because we cover everything. Everything is covered, guys. Everything is covered. All right? So when you come to our class or come online, you have access to all this video content. Okay. Let's give me about a minute. All right. So here we have, let me show you. So we have pharmacology, renal. I think this is cardio. All right. So if you look here, I'm just gonna spend just one quick second because I don't want to show you exactly everything here, but just a little bit, just to maybe just give you an idea. This is what the cardiology will look like, internal medicine, all right? And you'll be able to get, see all our lectures right here, okay? All the lectures that you're gonna have access to when you purchase this, all right? So if you wanna learn about hypertensive emergency, atherosclerosis, it's all right there for you guys, okay? All right, so I'm gonna wrap this up, okay? If you guys really wanna sign up for the course, I'm gonna put a bunch of links here for you. We've been here for the last almost 1 hour, almost 2 hours, right? Actually, it's 100 and almost getting close to 2 hours right now, okay? I'm gonna put the link for you guys if you're interested in signing up for the course, all right? We're gonna teach you everything you need to know to study for the board, all right? If you wanna join our masterclass, right here, just click it, join the masterclass. All right, and then this is, if you wanna join our class, just go to SmashUSMLE.com. It's a self-paced course. All right, remember you get private coaching, one-on-one with me directly, okay? We're gonna help you with your schedule. We're gonna coach you on how to get on the right track. That's what we do here, okay? And if you wanna, next live masterclass is coming up. Don't miss it, all right? It's pharmacology, baby, all high yield. So somebody wants to know what high yield is? Come to the live masterclass and I'll tell you. We can't give you all the information that you want to know here on YouTube. But if you wanna know what high yield information is, I'm gonna challenge you to come to the next master class or join the course so we can give you all the information. We've given you tons of value here today. This is what we do here at the course in SmashUSMLE.com. Listen, tell your friends, tell your colleagues, it's going down next week. Click on the link, and then I'll see you guys in the next class. You guys are super awesome. I'll be back on Monday again for another live session with you guys. You guys have an awesome day. Go to SmashUSMLE.com. SmashUSMLE.com. That's our website. If you've never been there before, thank you so much for coming to the live session today. All right. Yeah, unfortunately, yeah, we just wrapped up. You just saw this. I'm sorry, RUF forever. Listen, you can go back and watch the entire session. We're gonna put it up on YouTube. I'm gonna be here live on Monday. Okay. If you want to reach out to us, if you want to reach out to us, go to SmashUSMLE.com, like I said. And if you can talk to our customer service department. If you have any questions, listen, you guys have been phenomenal. If you have any questions, you can reach out to us. If you want to sign up for our class, we're giving out away a 50% off, okay? 50% off on our course. Use the code SWEET. Just use the code SWEET to be able to get 50% off. This is only an offer for the next 48 hours. It's not going to last forever, okay? To get 50% off. So I'm just putting it here for you guys, okay? Thank you so much for coming. I'll see you guys next week. You guys are awesome. You guys take care. Bye-bye.